Uh, okay, so all of you must have seen the portal sickle.nhm.gov.in, and let me share you the screen also. Okay, the screen is visible.
Yes, yes.
Okay. So you must be having the login facility as of now, currently, at the state and at the district level both. Is it? Are you able to log in onto the national portal at present?
We have the login option available at the state level, and currently we have 3 districts with the district login, but not all districts. So for many of the participants, this portal would be actually a new.
Please, all of you are requested to mute their mic if not asked for. Yes. Okay. So at the state level, you have the login facility, and the 3 districts that is in the pilot mode, they are using the credentials to log in into the portal. Is it?
Yes, yes. In this, again, there is one more thing. There are 2 districts for whom we have developed this state district level login, but they have not been able to add the end user institutions also. So those districts, I think they can comment now, if that is okay.
Yes, please. The districts.
Malappuram, Pameli madam.
So we can log in, we could log in, but when we add the peripheral institution, they can't access there through the portal. We can't edit, or we can't, even if we edit, it's not being updated in the portal. So they are not being able to add their details there.
Okay, so you are at the district level. You are the district. You will be a district admin user.
Yeah.
Okay, from the district admin user, you are creating a facility user and other users.
Yes.
Okay.
By creating the facility user, we are facing the issue.
The kind of issue that you are facing, because let me tell you one thing. This national portal actually have 2 interfaces. One interface is the portal that you can see right now onto your screen, and the other is app. And there is a mobile app for iOS as well as for the Android. Have you seen that app? Have you logged in into that app?
No.
Okay, so that is actually, I think, the issue, because now we have, because of right now, in fact, I was told that only the portal training will be there. So that's why now the question came that because the screen that you can see right now, this is a state level login screen. Okay, and in the state level login screen, and you are right now speaking from a district. So either it's a state or a district. So obviously you will be using this screen. Is it? Manage user. Is it visible?
Yes.
So from the add user, I think then obviously at the district level, I'm not logged in onto the district level, I'm logged in onto the state level. So at the state level, we have all the facility. We can add the state level users, we can add the district level users, we can add the health facility level users. And actually the health facility user is the user that is at the root level. Root level means at the PSC level, CSC level.
I'm sorry.
Okay, so as soon as, suppose at the state level, later on I will log in onto the district level also, or should I log in into the district level only? Whatever you say.
I think it will be better if you log in at district level and show them, sir.
Okay. Well, don't confuse with this login screen, because you people log in with the Parichaya facility, your government-based credential at the district level also. So this is for the demo purpose. That's why don't get confused. Okay, so now I am logged in onto the district admin user. Okay, this is the district admin, one of the district admin of Chhattisgarh state of Raipur. So as you can see in the left panel, we have manage user, and here, if suppose don't go onto the ad, at the level we have only the health facility. So by this you can understand that only the health facility user can be added from the district login. Means as a district user you can add the health facility user, and here the health facility user stands for the people working at the PHC, CSC and other health sub centers. So those are called health facility users. Okay, those health facility user can be anyone. It may be in the LTs that you have, it may be other technical staffs who are conducting the screening and the testing and all that. So you can have the health facility user created at your level. At your level means at district level. You can go on to the ad. Here you see there is only one level, that is health facility level. And as you go on to the health facility level, automatically it came state Chhattisgarh, district Raipur. Obviously, when you will be login from your district login, it will show your state and it will show your district. Facility type means the kind of facility that you are having under your district. It may be PHC, CSC, and all health sub centers. Suppose we have I have chosen one primary health center. Then after choosing the primary health center, it will show you all the PHC that is present in your district. Suppose I choose one PHC Bengali. You don't need to get uh, troubled by these health facility name and health facility type and all these. If there is any thing missing, you can report to us and we will provide you as required. However, I think everything will be already pre-populated. You do not need to add anything. So after selecting health facility, you can add any name, your designation, suppose LT, mobile number. Mobile number is very important. And always remember, when you create a health facility user, the health facility user now will have the access of the mobile app that is specifically designed for the registration, for the screening, for the treatment, testing, and everything. So you are creating a health facility user. It means, in other words, you are actually creating one mobile user under your district from one of the health facility which is present. So here we can have the mobile number and try to keep the mobile number, because the mobile number will be used for the OTP also. So keep the mobile number active. Role, health facility user, treatment user. Okay, we will come on to the treatment user later. In fact, it can be discussed afterwards also. And email address. Here you can have the email address, but even if you do not have the email address, you can have any email address in this format. Then after the save option, saved successfully. See the message, success. Now this health facility has been added under the district Raipur, health facility type primary sector, and health facility name PHC Bengali. Now if suppose you want to see or you want to edit something, you can go and click here and you can also edit. There is, when you go on to edit, there is one option here at the bottom level. You can say status, active, inactive. Now this is the facility. What happens that there are some temporary users also in your PHC and CSC and health subcenter level or health facility level. So for the time being, suppose some NGO comes, suppose some other tagged staff from different district is given for the expedite of testing and all that. So what you do, you create a health facility user, you make the status active, but as soon as the person leaves you and leaves your jurisdiction, you can make this status inactive so that he cannot log in from any other place. So this is also one thing that you can do, active, inactive. So once the user is now active and it is created, now you have the mobile app. And do you have the access of mobile app? Have you ever used the mobile app?
Why not district, please?
Any district, please?
Sorry.
Any district, please?
വയനാട്. വാണി,
ആ സർ.
നിങ്ങളുടെ പെരിഫറിയിൽ മൊബൈൽ ആപ്പ് യൂസ് ചെയ്യുന്നില്ലേ?
ഓ ഉണ്ട് ഉണ്ട്.
അത് പറയൂ, ഞാൻ ചോദിക്കുന്നു. So the Wayanad district is using the mobile app.
Okay, Wayanad district is using the mobile app, so you already have one supporting hand there in your state, that one has used the mobile app, and in fact the mobile app is quite easy to use. For the health facility user, only need to give the mobile number and the OTP comes, and once he log in through the OTP, then the facility and all the options in mobile app comes. The options are from the registration. In fact, the mobile app, you can have a look. There are some videos onto the portal in the video gallery of mobile app. You can access, because I didn't know that the mobile app was also, otherwise I would have shared it earlier. But onto the, you can see here, in the media gallery, we have the video gallery, and in the video gallery, we have complete video to show mobile app flow. Okay, we have the mobile app flow and mobile app functionality given here in the form of video. However, even if after going through the video and after talking to the nearby district who has already done, if any confusion and anything comes, then obviously we are here to extend the support whenever you need. Once the health facility user is created, now the health facility user is ready to use the mobile app and do the registration, testing and everything. As because onto the portal, we have very limited functionality. Most of the functionalities are now being used through mobile only. So I think there was some communication gap. Otherwise, I would have shared the mobile app working. Even if suppose that in this meeting it is not covered, we can cover it later on, because the mobile app is not something that you people are not used to. There are so many mobile apps that you already have used. So it is just one of the kind of mobile app that you can see and log in. In fact, I would like after this meeting that some of the district level users register their health facility users, 1 or 2 health facility users, and get the mobile app installed through Play Store or through App Store, because the mobile app is available for the Android and for the iOS both. So it's not like that only Android operating system mobile is used. You can have any mobile for the use of mobile. Okay, so once this facility user, this is the first step actually. You need to have the facility user so that one can use the mobile app, and through the mobile app, one can do the registration, and after the registration, one can have the screening, one can have the tests and all that. So, so step-by-step process. After the manage user, once the user is created, we have the facility management. Here we can just now someone has asked me that how to add the facility. From here you can add your facility master. Okay, you can also export to Excel. All the facilities will be exported. Here you can have the district. Here right now there is some issue. The block is not showing. When the block comes, then the taluka, the health facility type, you can have the health facility name, facility pin code, facility longitude, latitude, NIN number. NIN number, I think you people are aware or not, but there is an NIN unique number for every health facility of our country. So it may be known to you. If not known to you, then you may have the consult with the state. The state will have the access of this NIN number, because this NIN number is important. So using the NIN number and the health facility name and other details, you can add the health facility. Suppose one of the health facility is missing, then you can have. So you can add the users. Users means your health facility users. You can add the health facility from these two options. After these two options, there are some other options also. PBTG status update hydroxyurea status. I think these things, PBTG. Are you aware with the term PBTG? Is there the PBTG
Yes,
group?
yes. PBTG is there.
Okay, you have PBTG group in your state.
Yes, yes.
Okay, so from here you can add the PBTG beneficiary updated, because what happens that at the registration level, sometimes the category of the beneficiary or patient, you can say, patient category is not updated as PBTG. So from here we have the facility. In fact, in Chhattisgarh, Raipur, we do not have right now the facility PVTG. From the state login, we can have the PVTG. In this district, actually, there is no PVTG. That's why no data available is showing. Because it is not necessary that PVTG group means particularly vulnerable tribal group. So particularly vulnerable private group is not something that you get in every district. In some districts they are present, in some district they are not. So at the state level, if suppose we go on to the login onto the state level, we can have the PVTG here. This is the option here. You can see now this is the PSC. Right now it has come 106 records. You can see here there are 106 records. Now you can select right now like this and make the records as PVTG, and then clicking on update will update these 4 records as from category ST, it will become PVTG. Or maybe sometimes the category is chosen not correctly. So you can have this facility here because this is important. PVTG marking PVTG group is important because in the form of research and in the form of other benefits, we actually mark the category of the patients, which category they belong to, SC, ST, PVTG. Then we can have the grouping based on that. We can have the sessions based on that. Same as in the case of hydroxyurea. I think you all know what is hydroxyurea. Are you aware with the term hydroxyurea? I think you must be having because already you people are using sickle cell at the state level. So here, from here on, you can update the demo site has some issue. So only the site is stopped working. Okay, from here on, we can have the update hydroxyurea status. We can choose here again. This by default, it shows all the patients who are having hydroxyurea or not under your login. It always remember that if you are logged in through a district user or through any user, health facility user, then you will see only the patients registered under your name or which have been registered through your facility. It is not, however, you can see using the ID, you can see this is the Sickle ID. You can see the other also, but by default, it will show the records which belong to you. It doesn't, it is not as if it will show you the records of all the health facility. Suppose this is the updated hydroxyurea. Yes, no, you can, in fact, the patients that is showing right now, it all has hydroxyurea status, yes. Now you must be thinking that these things are okay that we can see into the login, but still we have the issue that of suppose the registration again I am telling you the registration of patient will be done through app only. If suppose you have to register any patient, because if you don't register the patient through the app, then this Sickle ID that is unique, it won't get generated. And unless until this particular Sickle ID is not allotted to the patient, then the other test, treatment, and all these things is not available through a mobile only. So for getting the Sickle ID, you need to register first the patient through the mobile. So these are actually the 4 things that you can have from the login. And then again, after that, there is only the report portion that you can explore by yourself also, because the reports are self-explanatory and reports are quite easier to understand. User creation status report, patient under confirmation, patient test report list, notification. So these are the test report, committee MOM report, screening count report, block wise or health facility wise report, facility user wise report. There are multiple reports available here. So you can have the look over the reports, because if suppose I go on to explain each and every report, then I think it will take hours. It will be quite long. And more so, these reports are not that much complicated. So one needs to understand through special means. So you can understand by yourself also. And if again there is any confusion, then you can escalate to us also and to a state level also. So this is a district level user that we are logged in. Same as in the case of state level also, there is nothing special mentioned in the state also. You can have the state, it will have the same facility. Meanwhile, if you have any question or query, you can have the questions for 2 or 5 minutes, so that after that we log in onto the state level. Am I audible? Hello. Hello.
Yes, sir, you are audible.
Okay. So, Rinsati, if is there any confusion till now, we can have a quick overview.
Yes, sir.
Anybody has any questions till now? ആർക്കെങ്കിലും എന്തെങ്കിലും സംശയം ഉണ്ടെങ്കിൽ ചോദിക്കണേ.
And one more thing, it's my suggestion and it's my humble request also, that because it's just a kind of kick start. So even if after the training you get some kind of issue or some kind of problem, then obviously at the state level, the people are present to extend all the possible help. And here at a headquarter level also, at a Delhi level also, we are here to help you anytime. However, because the 4 districts that are already onboarded, so I don't think there will be any issue. You can have a quick way around with the people already working. So, and more so again, I'm telling you, it's a very easy and very simply performed activity that is faced onto the portal also and onto the app. We take quickly go on to the state level also. There is not much difference from the state to this.
Alokji, before that, I have one more point that need to be stressed. So there is a part B for this portal, right? Regarding the treatment part.
See, the treatment is actually not part B. You can say the extended part. Treatment user is made through the district level and through state level. So, and treatment user can be onto the portal also. Means the treatment user, like the registration is done only from the app, but the treatment user has the facility to perform the treatment. And to treatment means what? Treatment means medicine. Treatment means blood transfusion. Treatment means lab test. So actually these are the part of treatment, and these treatment has actually 2 way. One, either going through by portal or by going through app. That's why we have the treatment user portal especially made in the user menu. You could see there are 2 options, one health facility user and one treatment user. So that's why the treatment user is the extended part that is given in both forms, at the portal also, at the app also. Yes.
No, why I asked that question specifically is when we have this national review, what I see is that the treatment part, apart from the updation of hydroxyurea and the testing part, the treatment part like blood transfusions taken and other parts is not being filled from the district who is already using this. So if you can just brief them about that part, then that issue will be solved as well.
The treatment user. Okay, I will
Yes.
check the treatment user.
വയനാട് ജില്ല ഇപ്പൊ യൂസ് ചെയ്യുമ്പോൾ ഫേസ് ചെയ്യുന്ന ബുദ്ധിമുട്ടുകൾ ഉണ്ടെങ്കിൽ അതിപ്പോ ക്ലിയർ ചെയ്യണേ.
ഹലോ സർ. ഹലോ
യെസ്, പറഞ്ഞു.
സർ, നമ്മൾ പോർട്ടൽ ഫെസിലിറ്റിന് ആഡ് ചെയ്യുമ്പോൾ നമ്പർ ആഡ് ചെയ്യുന്നില്ലേ?
NIN നമ്പർ ആണോ?
അല്ല, സാധാ ഫോൺ നമ്പർ.
ഫോൺ നമ്പർ.
ഫോൺ നമ്പർ പിന്നീട് ചേഞ്ച് ചെയ്യാൻ പറ്റില്ലേ?
പിന്നീട് എന്ന് പറഞ്ഞാൽ പിന്നെ എഡിറ്റ് ഓപ്ഷൻ എടുത്തിട്ട് ആഡ് ചെയ്യാം.
അതായത് ഒരു നമ്മൾ ഒന്ന് മാറ്റം വരുത്തിയിട്ടുണ്ടായിരുന്നു, പക്ഷെ അത് മാറ്റം വരുന്നില്ല. OTP പോകുന്ന വീണ്ടും ആ പഴയ നമ്പറിലേക്കാണ് പോകുന്നത്.
ഓക്കെ, അതായത് നിങ്ങൾ ഒരിക്കൽ ഹെൽത്ത് ഫെസിലിറ്റി രജിസ്റ്റർ ചെയ്ത് കഴിഞ്ഞപ്പോൾ അന്നൊരു നമ്പർ കൊടുത്ത് പിന്നെ അത് എഡിറ്റ് ചെയ്ത നമ്പർ മാറ്റാൻ പറ്റുന്നില്ല.
അതെ, നമ്പർ മാറ്റാൻ പറ്റുന്നുണ്ട്, പക്ഷെ OTP പോകുന്നത് പഴയ നമ്പറിലേക്ക്.
പഴയതിലേക്ക്. Okay. Alokji, there is a concern that has been raised from a district. The thing is that they have registered a health facility from the district level at the time of which they have given a mobile number. So using the edit option, they actually change the number, but the OTP is being forwarded to the previous number itself.
Yeah, that is actually the mobile number gets, because it has the app facility also. But have you checked that the new mobile number that you have given? Because right now I think we have the facility, the new mobile number gets updated, and as soon as you log in through the new mobile number through app, the old automatically gets logged out. So did you check that?
മലപ്പുറം അങ്ങനെ ചെയ്ത് നോക്കിയിരുന്നോ?
ചെക്ക് ചെയ്തിട്ടുണ്ടായിരുന്നു.
അതായത് പുതിയ മൊബൈൽ നമ്പർ വഴി ആപ്പിൽ ലോഗിൻ ചെയ്ത് നോക്കുമ്പോൾ പ്രശ്നം പരിഹരിക്കപ്പെടുന്നുണ്ടെന്നാണ് പറയുന്നത്. അങ്ങനെ നടക്കുന്നുണ്ടോ?
ഇല്ല, ഞങ്ങൾ ആപ്പ് ഉപയോഗിച്ചിട്ടില്ല.
They haven't tried that, so let them try that. We will see that. Okay, you just try in case any issue remains, then we'll solve that. Okay, suppose right now I am logged in through a treatment user. I think you all must have seen the process, because after going to the login, now understand one thing: health facility users treatment that the treatment user that we have logged in onto the portal is by using the mobile OTP. Okay, because the mobile number is mandatory for the treatment user to get login onto the portal. And after going to the portal, now here you can see Alok treatment user portal, state, district, and the health facility name that I am enrolled in. See, now going on to the treatment, here you can search the patient. You can search the patient through three things: Aadhaar ID, Sickle ID, mobile number. Because one of these three things you need to have to search the patients. And suppose right now, if see, I have searched the patient through this Sickle ID, and it has fetched the detail of patient, facility in charge patient, Sickle ID, this state name. See, I have searched the patient through Sickle ID, and actually the patient was from Tamil Nadu. And here I am the facility, treatment user of Odisha, Baleswar. So it is like that we can have the treatment of patient of any state at any treatment user facility. So this is the facility that is given. So that is why I have taken this particular ID. See, this ID belongs to the state name Tamil Nadu, district name Namakkal, and other details. Disease thalassemia. I think why not you need to mute your mic. Now, suppose you are going for the treatment. See, the treatment that we are talking about: personal detail, name, gender, mobile number. Here you can update these things only once. That's why we have the verify button here. You can change the mobile, you can change the blood group, you can change the DOP, because current DOP is calculating from the being calculated from the value that has been already registered at the time of registration. So if there is any discrepancy in data, you can have the verify, these three things: mobile number, blood group, verify. So once the personal details are verified, you can go after saving, save, and next. You go on to the next tab, medicine. Now here in the medicine section, you can have the health facility type, prescribed primary health center name, because you are right now is Antara. HF type, dispensed, PF name, drug name. Here we can have the drug name. See, these are the 4 drugs that has been actually prescribed through the national level. You can have any drug, then the quantity. You can have the quantity. Date of admission. Okay, one more thing. You can have multiple drugs also. Okay, you can have multiple drugs also. So you can have the other drug detail also. See, one drug is already selected, so only 3 are now being shown. Doses already given. These are the standard doses which are written here. Now you can have the blood transfusion. Now see the preview. Before final submit, you can see the final preview. However, there is one thing that is missing that I need to check, that I have actually filled drug name twice, but only once it came. I think there may be some technical issue in the demo part only, that I will see. The medicine detail, the blood transfusion detail. Now, after the final preview, note, please click on final submit to save your data. If all good, then we can have the final submit. Are you sure you want to submit the form? You can submit these details, and these details will be submitted to the particular Sickle ID, this Jyoti Mani, of particular that person who was from the Tamil Nadu district. So you have now filled in the details of medicine, the blood transfusion of a person who actually belonged to the Tamil Nadu district, but came to your health facility, and you have done the treatment as prescribed here onto the portal. And same thing is onto the uh, mobile app also. Now suppose if again you see the detail, see this particular person was think there is some, because we're working on demo site, something are actually not working. We could see here the previous history also, because I wanted to show you the previous history, because just now I have filled in the detail. And if you go on to see the previous history, then it shows you the history of those particular patients. So this is actually the treatment part. Personal detail we can change, medicine, blood transfusion. Then after preview, we can have the final submit. Now there are only 3 options: treatment dashboard. In the treatment dashboard, under your particular treatment user in the health facility, you can have the number of total disease, the disease on hydroxyurea, on blood transfusion. It will show you all the details here in the form of dashboard. Right now, there is nothing present. That's why it is showing 0, 0. So it's a kind of dashboard where it shows all the things. All the things means number of diseased, patients on hydroxyurea, and blood transfusion. It will show you the numbers, which it will in fact give you an idea how many patients are present under your treatment user facility. Suppose under your treatment user facility, you have 50 patients or 100 patients. So it will show you the details in numbers here onto your dashboard. Lost follow-up. This is also one thing that is sometimes being asked for, that one person came after the registration or after the testing, he didn't turn up for months. But so you can have the Sickle ID. After the Sickle ID, giving the Sickle ID here, you can check whether that particular person, here it is not showing the search lost follow-up with this particular ID, because from the last 3 or 4 months, if he does not have any visit to any of the health facility, it means that person is lost, because you need to visit the health facility at least once in 3 months or 6 months, whatever doses or whatever treatment is being given. So accordingly, the time frame is given 3 months, 6 months. So if suppose you are responding for the longer period, then it will show you that your last visit date internally, it maintains the record that your last visit date was such this and your visit count was this. So after giving the Sickle ID, it would have shown that the last, see last medicine dispensed, last lab visited, pending reason, status action. So it would have shown all things. If suppose the person is not traceable, sometimes the person becomes untraceable. So actually, this is the treatment user. The treatment user has mainly the one most important thing, that is the treatment. In the treatment dashboard, there is only the numbers that we see. Lost follow-up, obviously, if suppose if someone is untraceable, then we can have the follow-up with them. So these are the three facility in the treatment user. And if the treatment user, we have the health facility user through the app, then the same number of options will be shown onto the app also. So this is the treatment user. Just a minute, there is some one call I need to take. Okay, so this was more or less an idea of the portal, the treatment user and the other users that we can work on to get the idea of get the details of the Sickle ID patients, Sickle patients, and thereafter the processes that we have after the patient comes onto our system. So these are the things that we have covered in short. There will be some more exposure when you go on to work by yourself through portal or through app, because then you can have some more confusions also, some more issues also. So by the time you start using it by yourself, no matter how many and how much training I give you, you will always have some kind of confusion of one or two. So I request that if you start working from tomorrow, from day after tomorrow, you can have a fair idea. And it's a very easy process, because you already have used your state is already using the state flow of thalassemia, sickle, and hemophilia. So you won't have that much confusion here in this portal also. So Dr. Rahul and Ritsa, if there is some confusion and there is some more that we need to discuss, then we can have. Otherwise, we're taking leave.
Okay, so can you please also brief on how this hemophilia details are being entered? Because
same as sickle, there is nothing special in hemophilia, and there is nothing special in thalassemia also, because these are all blood disorders. These are all blood disorders. So actually, that's why they all have been combined. There is also one other variant also. So there is one sickle, there is thalassemia, there is hemophilia, there is other variant, and all are being covered here onto the only thing that we have now, that in the sickle we have the treatment module covered. In thalassemia, we have the treatment module in a process. I think within a fortnight, 15 days or 20 days, we will have this treatment of the thalassemia onto the mobile app. Otherwise, rest options are same. Rest things are same. The test method, you all know, being in the medical field, that in the sickle there are a special kind of test. The same test, some of the tests are being carried for the thalassemia also. For